So this happened in a tech park in Bangalore where none of these bystanders knew what to do. So this is where the basic life-saving skills can be handy. So today we have Dr. Rashmi Aradhya, who is heading the healthcare training division at Laerdal Medical India. So we would like you to talk about some of these basics, like the difference between cardiac arrest and heart attack, how to assess a person who is suffering from cardiac arrest, and how to perform CPR. So would you please start with the difference between cardiac arrest and a heart attack?
Yeah, in layman terms, a heart attack is a plumbing problem and a cardiac arrest is an electric problem. Just to explain it a little more, in heart attack, the blood supply to the muscles of the heart itself gets either fully compromised or partially compromised, because of which that portion of the heart is not able to pump as much blood to the rest of the body. Now, what happens in a cardiac arrest is the heart completely stops beating.
Thank you. Now, doctor, how to assess a person who is suffering from cardiac arrest?
So, in a cardiac arrest, you can check the responsiveness of the person. He will be unresponsive. You have to check the pulse of the person over here.
Yep.
There will be no pulse. He will be pulseless. And look at the breathing. He will not be breathing.
So, no breathing, no pulse.
No pulse.
Thanks.
And unresponsive.
So, doctor, how do we respond when a person is suffering from cardiac arrest?
It's a very simple thing to do without wasting any time. Start CPR, that is Cardiopulmonary Resuscitation.
So, can you please give us a demo of a CPR session?
Sure, we can absolutely do that right now. We have a trained provider in CPR and who's a certified BLS provider, our colleague Biju Sam, and he will help us demonstrate CPR skills right now.
Sure, thanks.
So here we are going to be now demonstrating the CPR itself. So Biju is going to be doing the demonstration. Are you ready, Biju?
Yeah, ready.
All right. So once you see a collapsed person, the first thing you check for is the scene safety. After that, you check for the responsiveness of the collapsed person.
Hello? Hello, are you okay? Hello?
If the person is not responsive, immediately call the ambulance on 108. If somebody else is making the phone call, at the same time what you can do is check for the pulse as well as the respiration of the collapsed person.
No pulse, no respiration.
So immediately you need to move the person onto a flat but a hard surface so that you can start compressions, chest compressions and rescue breaths. So how would you start chest compressions? You place the person flat on a hard surface, and between the nipples on the sternum, start with the most dominant hand on the bottom, and then you need to start compressing, and it needs to go down almost 2 inches or 5 centimeters down and completely recoil. And you need to do this at a rate of 100 to 120 per minute. And after you've completed 30 compressions, give a break so that somebody can give rescue breaths. 2 rescue breaths, 30 compressions, 2 rescue breaths, 30 compressions, 2 rescue breaths. And the cycle continues. Can you start now?
Yes. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
2 rescue breaths given. Start compression.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
So this is the cycle that needs to continue all the way until the ambulance or the healthcare rescue teams arrive. Please learn CPR and help save a life.